watching Local 10 News, your problem solver station.
Welcome back. Since the world's first test tube baby back in 1978, the advancement of technology in reproductive medicine has truly skyrocketed. More than 6 million Americans right now, that's about 10% of the reproductive age population, are affected by infertility. And 85 to 90% of the cases can be treated with drugs or even surgery. But still others do need help from procedures like in vitro fertilization, where eggs are removed from the body and fertilized in a lab. So we followed several couples for the last 6 months as they began the process of in vitro. And tonight we see the ups and downs of this amazing journey.
We have been trying for 13 years since we got married.
Yablin and Reynaldo Bonet desperately want a child. So do Trisha and Omar Vega. Both couples needed help getting pregnant for different reasons.
You know, and I kept saying, no, it ain't me, it ain't me, it ain't me.
And talking more with the patient, they realized that he had a history of some discomfort at some time in the past. And
turns out Reynaldo has obstructed azoospermia, a condition urologist Dr. Harvey Samowitz says he's seeing more often.
It may be due to trauma or injury or infection.
He had the ability to produce sperm, but couldn't deliver it where it needed to go. So using a small needle,
so we were able to go directly to the testes where the sperm are being produced and extract the sperm from there.
In Omar's case, he had a vasectomy after the birth of his daughter 18 years ago.
I thought when I got my vasectomy reversed, I would be fertile again. I would go home, have sex, and she would be pregnant.
And we see that there's 83% of the sperm are bound with antibodies.
I have, for one, a low sperm count, and I have antibodies on my sperm, which makes it a double whammy. So it's going to be a little bit difficult.
There are a number of procedures to help with infertility. Among them, ovulation stimulation with medication, donor egg fertilization, donor embryo transfer, intrauterine insemination for mild sperm conditions, and in vitro fertilization for both male and female problems.
40% of infertility is due to the woman, a female factor, 40% for the male. Some male causes can be treated without in vitro fertilization, but some of them cannot.
For both couples, the team of doctors at South Florida Institute for Reproductive Medicine recommended in vitro fertilization with what's called ICSI, or intracytoplasmic sperm injection.
Over 50,000 IVF procedures done in this country every year, and half of them are actually done with intracytoplasmic sperm insertion.
In a laboratory, sperm is injected into the egg that's been retrieved from the woman's ovaries.
Okay, we got our first egg, they say.
Then the embryo is transferred back to the woman. The whole process can be challenging, with daily injections for the women in the beginning, many doctor's visits, and other procedures to follow. And even after all that work, some couples don't get pregnant. Yet there's more hope today than ever before.
Whereas now we can say just about any couple, one way or another, we can help them to become parents.
So did our couples become parents? Find out at 6 o'clock, when we're also going to talk about the cost of infertility procedures and the sacrifices these couples made to become parents.
A lot of couples are going through them. You're
it is true,
two,
and there are
a lot of couples.
so many options now available that it's just amazing the different things that can be done. So we follow these two couples and see how it all turns out at 6.
6 o'clock.
Yep.
You're watching Local 10 News, your problem solver station.
At 5 o'clock, we introduced you to two couples whom we followed for 6 months as they went through the process of in vitro fertilization in an effort to become parents. This process can be tough on couples, physically, emotionally, and financially, because the average cost of an IVF cycle is around $12,000, and some couples have to try several times before they see any results. Well, now we find out if the couples that we've been following got the results they were hoping for. Here's Christy Kruger.
And that's got your name on it, and this is for your baby book, and congratulations.
Thank you. I want to hug everybody.
Tears of joy for Trisha and Omar Vega. The couple got pregnant after their first try using in vitro fertilization with ICSI, or intracytoplasmic sperm injection. In a laboratory, sperm is injected into the egg, one that's been retrieved from the woman's ovaries.
Okay, we got our first egg, they say.
Then the embryo is transferred back to the woman. The Vegas had to get the help of infertility specialists when it was discovered Omar's sperm was covered with antibodies.
The problem is when we start to have antibodies that are attached to the head of the sperm. The sperm have a very difficult time penetrating the egg because there's antibodies stuck all over it. And the likelihood of success with insemination is very low.
So you can see nicely.
The Vegas had a 75% chance that in vitro would work for them. Fortunately, it did, because the process can be expensive.
Just our regular IVF myself is almost $10,000.
Yablin and Reynaldo Bonet opted for in vitro fertilization as well. Reynaldo has obstructed azoospermia, the ability to produce sperm, but the inability to deliver it where it needs to go. The Bonets were able to get financing for each IVF cycle, but one thing most couples don't realize is you must have flawless credit to qualify.
We do have financing options available. We have discount plans available, and we're trying to work with insurance companies as much as possible.
Infertility specialist Jürgen Eiserman says most of his patients are willing to pay the price and plan for the cost.
Well, the factor of cost has to be looked at not only as a single price for a single procedure, but as a treatment that sometimes stretches over years.
Yeah, well, this time it didn't work, but we're going to keep trying.
The Bonets didn't get the news they were hoping for, but they say they'll take a much-needed vacation and plan once again for the financial burden. As for the Vegas, they may have to do some financial planning of their own.
We actually have twins. Getting nervous there. A little bit more difficult to measure.
It's twin girls for the Vegas, a sweet payoff for the cost and efforts they put into this. Infertility specialists say a successful result is possible for many couples who are having trouble conceiving.
If there is egg and there is sperm and you have a reasonably healthy uterus, even if we have to fix it in some way, you have a pretty good prognosis.
With ICSI, one sperm is injected into the egg and then transferred back to the patient within 3 to 5 days. Before this procedure first surfaced in the early 90s, only donor sperm was available for couples to use. Researchers say the future of ICSI is even more promising now, with current fertilization rates improving beyond 85%. With a special Good Health report, I'm Christy Kruger.